Thank you to Sid Wilson and all our panelists for the first panel of the summit. Let's keep this going with our next discussion, a spotlight on Latina representation in STEM and health fields. Latinas in science, technology, engineering, and mathematics are leading the way for the next generation of scientists who will cure cancer, innovate technological integrations, and engineer with sustainability in mind, all while solving the challenging problems of tomorrow. Let's join efforts to inspire and mentor more Latinos to accelerate representation in the STEM and health professions. Moderating this important conversation is LULAC's National Programs Manager, Sandra Caraveo. Welcome, Sandra.
Hi, everybody. Thank you so much for joining today's discussion of Latina representation in STEM at the 2021 LULAC National Virtual Summit. I'm Sandra Caraveo, LULAC National Program Manager, and your moderator for this session. Latinas in STEM, science, technology, engineering, and math are leading the way for the next generation of scientists who will cure cancer, innovate technological integrations, discover and engineer with sustainability in mind, and solve the challenging problems of tomorrow. This particular topic is of importance to LULAC as we have made it a priority to propel young Latinas from middle school age to young professionals to pursue STEM-based careers and studies. Currently, Latina women only make up 3% of the STEM workforce. Oftentimes, STEM programming is not available, especially for communities of color, until high school or even college. As Latina women head into the workforce, we often find that Latinas often face obstacles that impede their career development. However, in order to prepare our young women to break into these in-demand careers, we must start early. This means promoting better career opportunities through education, professional development, and mentoring. It is important for participants to hear firsthand how we can create these opportunities to propel more Latinas to pursue STEM careers and also have some of the professionals that are currently working in these fields really share their activities, what they've been through, how they've been able to go ahead and develop themselves into young Latinos working in STEM. It is a priority for us to also ensure that companies understand the importance of creating a diverse workforce that is supportive of minorities and women of color. With so much social change happening in many movements, I think it is important for us to be able to hold companies across the globe accountable and make sure that they're paying attention and make this a priority to inspire and mentor more Latinos and Latinas to accelerate representation in STEM and health professions. It is now my pleasure to introduce our two panelists joining us today. Dr. Carlos Quezada Ruiz is a senior medical director on Genentech's ophthalmological clinical science team and a practicing retina specialist in Monterrey, Mexico. Dr. Ruiz is also the late-stage lead for gene therapy efforts with Genentech. Welcome, Dr. Quezada Ruiz. We also have Carolina Yvette Mejia, Senior Diabetes Care Specialist with NovoNordisk. Carolina is a bilingual certified diabetes care and education specialist and a registered dietitian with 9 years of experience and over 16 years of experience in the healthcare field. She is an expert in diabetes management and the competitive market of treatments that are available to the public. Thank you so much for being here, Carolina.
Thank you.
Now, as we dive into our panel, I will go ahead and start talking a little bit more about your experiences as minorities, as a woman working in these healthcare fields, and also what the companies that you're working with, who you work with, what they're doing in terms of creating some of these opportunities. So I'm going to go ahead and turn the floor over to you, Dr. Quezada Ruiz. Tell us a little bit more about Genentech and your experience as a minority and how you have been able to uplift Latinas that are colleagues and peers.
Sure, Sandra. Well, first of all, I want to thank you and the League of United Latin American Citizens for this invitation to share this space and have this conversation. So I think it's really critical that we do have them. It's a great honor for me to be here with you and Carol. As you said, by the way, thank you so much for that very kind introduction. I'm a retina specialist by training. I still care for patients, and I also work as a scientist at Genentech Roche. Genentech is a very science-based company that was founded, and it's based in the Bay Area, where inclusivity, I think, and diversity, it's actually at the heart of all of the things that we do. I feel fortunate that I work at Genentech Roche, not only doing research, where we're also having a lot of efforts towards advancing this inclusive research and health equity. We're implementing inclusion of underrepresented groups in research and in care delivery as well. We're also fostering belonging at our company by having a more diverse employee base. We have several groups within Genentech like SAGNES and others that propel the career development of people from minorities, and specifically to us Latinos as well. So in addition, the company is actually actively investing and cultivating partnership to advance this diversity and inclusion across healthcare, education, and all the communities as well. So in that sense, I feel very fortunate to be working with Genentech for that matter.
Wonderful, thank you so much. Carolina, I know that you have been working with NovoNordisk the last 9 years. Can you tell us a little bit more about why you felt that this company was a great fit for someone that is a Latina working in healthcare?
Yes, so I worked in clinic, so I worked with endocrinologists, so I was their diabetes educator and registered dietitian. So I had never been in big business, right, or in pharma, and so this is very new to me. So when I joined NovoNordisk, it was always about the culture for me for NovoNordisk. I had the interaction with the representatives that would come in, and we would have discussions. And what we're doing at NovoNordisk right now is we have a lot of employee resource groups, one of them being HOLA, which is Hispanics and Latinos in NovoNordisk. And we also have WIN, which is Women in NovoNordisk. So these ERG groups, I'm very active in both of them. And one of the things that we've been able to do is actually provide Spanish translation for our privacy information that goes online for our Spanish speaking customers. So that way they understand kind of what's happening when they're searching the website, but also we focus on supporting each other and finding developmental opportunities and opportunities for growth, not only in the industry, but just in healthcare in general.
Wonderful. Thank you for sharing that. And I know that you touched on ERG groups, and I know that those are so important for so many of us working in these industries, really being able to find like-minded people that may have come from the same background. So this leads me to my next question, and this is for both of you. I'll start off with Carolina's answer. What are some of your favorite aspects of the industry, and why should Latinas consider a career in STEM or healthcare?
This was probably one of my favorite questions. And I get asked this oftentimes, even when I do interact with individuals who are pursuing a career in healthcare. It really motivates me. And I think for me, my favorite aspect is knowing that you're making a difference, that you're actually having an impact on people's lives. And for me, that's what's most rewarding, is that you're actually helping to improve that. And I think with NovoNordisk, because the focus right now has been in research and education in regards to diabetes and obesity, which affect largely our communities, I think that's so important. And so I always encourage young women, young Latinas, to just keep going and try something new. And this is a way that you can impact our communities at large.
Wonderful. Dr. Quezada Ruiz, how do you feel about joining this particular healthcare field? Can you give us some advice, something that you'd like to share with some of these folks that are tuning in today?
Sure. I mean, from my perspective, I think that, one is never happier than when you're actually helping someone else, and healthcare, and being a physician in particular, I think gives us that privilege. We help people live better lives overall. We welcome new human beings as they arrive in this world. And as physicians, we walk with them through their disease processes and whatnot, and we also sometimes get to be that last person that someone actually sees in this world. So I think it's we're given a huge responsibility, but that comes with many privileges. To me, being a doctor and having helped patients, it's not, I don't see that as my duty, but I actually see it as an honor that I have the opportunity to actually do. So when I think about why should Latinos enter medicine, I think there's several reasons. I think in general, Latinos, we are caring and loving people, and I think that caring for patients then just comes natural for us. So in the U.S., if you look at the population demographics, we're talking about 30% of the population in the U.S. is composed by minorities, and we have data as well that shows that having a physician who represents you as a population can actually help improve compliance and overall medical care, because your doctor then understands your culture, your struggles, and even your jokes. So I can speak a little bit about my field in ophthalmology, where only about 6% of the ophthalmologists in the U.S. are from minorities. So there are many patients, about 24% of the patients from minority groups, including Latinos, who don't have an ophthalmologist who can actually represent them as a group. So yes, I mean, please join the healthcare industry and ophthalmology in particular. We have a lot of patients that we need to help.
You brought up some really, really great points. Just, it's so important for us to find that comfort. We may be the first and last to be with an individual, and I think that this really leads me into the next question that I have. Carolina, what are some of the misconceptions that you had about entering the STEM and health fields as a Latina, and how has your experience debunked a lot of these misconceptions for you personally?
Yeah, I think personally, my biggest misconception, I grew up in South Texas in a town where everybody looked like me. We were all of the same culture. There was not a lot of diversity. And so for me, it was feeling like I wasn't academically prepared to go into this field. When I went into college, my peers were at a different level, I felt like, academically and financially too. So that was a bit of a struggle. And I think the misconception is that you have to go to a various, established school, or you have to have a certain experience or life experience before you go into these fields. And that's not the case. I found that, my work ethic and my persistence and my resilience really helped me. And there was professors that noticed this and that would help guide me. And I think for me, the biggest thing is that, finding a mentor. That was so valuable, because you come from where you're the first person going to college, you don't know how to navigate the system, how to even interview for a job, and so mentorship is so important.
I absolutely agree with you, and I think this is why there's such importance being able to establish some of the programs, in particular that LULAC runs throughout the country, being able to build that confidence, build these opportunities, be able to really have mentors for some students and young professionals. And this leads me to another question about, Dr. Quezada, Ruiz, what is one thing you wish you had known before entering the STEM healthcare industry, and would it have changed your trajectory into the field?
Great question, Sandra. I'm not sure there's just one thing that I would have known that would have probably changed my career. I think I would have just wanted to have had more access to scholarships, to worry less, about the financial burdens, and focus more on my career. And at the same time, I think that the advice that Carol just gave around having a mentor, which is something that kind of occurred organically in my career, but I never really was looking for one. I wish someone had actually given me that advice so I could actually proactively look for one earlier in my career. Because yes, mentorship, cannot be highlighted enough as a very important source of knowledge and support in general.
Absolutely. And this question really is for both of you. We'll start off with Carolina. What are some of the current challenges that you face, that you find unique to your particular industry?
So that's such a hard question, I think, for me to answer, that are specific to this industry. I think the biggest one, and this is a bit personal, right, is that the feeling of isolation. And by that, I mean that, growing up where you're immersed in a Mexican American culture and you find it hard to kind of connect with others while maintaining the core of who you are. I think I felt like I had to change who I was to accommodate or make other people feel comfortable. And so I feel like that was kind of hard. And I felt like I didn't feel comfortable sharing my ideas or my thoughts in this field because, like Doctor was saying, it is dominated by men. And sometimes as a woman, you feel a little uncomfortable taking up space and feeling like you're still respected and heard,
Absolutely. You brought up a really great point. This is male dominated, and it's very difficult for us to not have that imposter syndrome, as Latinas working in a professional space, and really being able to provide that allyship from your male colleagues is so important. Dr. Quezada, Ruiz, what do you feel is important in terms of being that ally to some of your female peers and counterparts?
I think it's a great question. I think it, probably stems many different things. I think Carol just pointed out of one very important factor, which is that imposter syndrome as well, that we all face in general as Latinos. And I can only imagine that, being a woman is even tougher. There's this organizational psychologist out of Wharton called Adam Grant, who, if you don't, haven't read anything from him, I highly recommend him. And just recently, I was seeing a post he had on LinkedIn where he had this cartoon about a woman sharing an idea, and then this guy next to her basically saying, "Oh, that sounded great. I can't remember the exact wording, but sounded great. Now let me say it louder so people can buy the idea," or something like that. So I think something that we have to be doing on a daily basis as men is being conscious about, and this is not only as men, but as human beings, our brains are developed and organized in a way that we function under a lot of biases that were developed to ensure our survival as a species. But nowadays, most of the time, they're probably doing more harm than good. And some of those biases may be related to this cartoon that I quoted from Adam Grant as well. So being conscious about that, kind of following through, the ideas and echoing, when women in the room are actually portraying, new ideas and championing those ideas as well. I think it's really important, and giving everyone in the room the safe space and the time to be able to share their thoughts as well. And I think it starts with, I don't want to be quoting a lot of authors, I guess, but out of quoting someone else from Texas as well, as Brené Brown, mentions that, that art of being vulnerable and making sure that everyone feels safe to share their thoughts. Because I think if not, we're missing so much by not having that diversity of thinking from people from different backgrounds and different genders as well in our industry.
Absolutely. And I know when we started our conversation, both of you shared some insight to your respective companies, and how they've been able to go ahead and champion a lot of diversity and equity and inclusion. But how do you feel in terms of some of the progress that is still left? We'll go ahead and start with Carolina. What do you think still needs to be done in terms of being able to keep elevating diversity, inclusion, and equity in these respective fields?
Yeah, I think there's been a shift already with many companies kind of having thought leaders in this industry or in that specific topic. to build awareness amongst other people, just so that we're understanding the impact of diversity, equality, and inclusion. I think, our NovoNordisk has done this a couple of times. And I think the most important thing is knowing that it's not a one and done kind of thing. It's a process, right? It's ongoing. And still having these conversations, like within NovoNordisk, within our ERG, we have the opportunity to have talks like this with our executive team. And so they allow us to share kind of our insights and our perspectives, so that way they can at large kind of impact the rest of the company. And I think it's a continuing process.
Absolutely. Dr. Quezada, Ruiz, would you like to share some thoughts on that? I understand you also have a very unique situation where you work in Mexico and the US. So, there's definitely a shift there as well. So in terms of just diversity, inclusion, and equity, what do you feel there still needs to be work done in that field?
I mean, there's a lot of opportunity for sure. I think we're heading in the right direction. This meeting is a precise example of that. The fact that we're having a conversation about it, we're creating awareness among ourselves and among our colleagues as well, I think is the first step. I mean, I know that, as Carol had mentioned, not only Genentech, NovoNordisk, but, other companies as well are doing a lot of investment in this areas as well. We're at Genentech, there are trainings for, unconscious bias as well, as hiring managers to have a more inclusive mindset as well, and to give opportunities so we can actually, double the representation of Hispanic and Black, employees at all levels, including, of course, directors and above as well. I think we're fortunate enough as well at Genentech that we have Quita Highsmith as the lead for our diversity and inclusion efforts, and I believe that over the past few years she's been able to really spearhead a tremendous advancement in this regard. As I've mentioned in the past, Genentech is a very science-based company, and she's been able to fight and spearhead, having more inclusive trials. At the same time, as I was mentioning, this fostering belonging a movement to increase, representation, and as well, creating commitments and partnerships with other companies as well to keep increasing this representation.
And that is so important, creating those multiple touch points from entering the workforce and really making a career at some of these companies. We certainly want to see more minorities, more women really take those steps and carve out a long-term career and be a part of the change. I think it's really wonderful, and I commend both your companies, for being aware, walking the walk. This is not a trend in terms of diversity, inclusion, and equity. Again, thank you guys so much for being able to, be those agents of change within your companies as well, and with your colleagues. This leads me to my next question. LULAC does a lot of work with young professionals, students as well, collegiate, high school, really trying to open these doors up, to learn about STEM-based learning, careers, what that looks like. What is your advice to, young Latinas who may be hesitant to enter, a STEM career? Carolina, we'll go ahead and start with.
Sure. I love this question. I think for me, if I put myself back where I was, 20 some years ago, it's kind of starting out and going into college and thinking about going into this career, it would be, don't allow your challenges or maybe even your starting point to determine where you're going to eventually end up, right? It's not about where you start, but where you finish. And I think that in this field, you have the opportunity, again, to contribute to your community in a very big way. And if you want to improve technology and, advances in medicine and engineering, I think we need to have a seat at the table as Latinas, right? We have to be able to contribute. And I think that the possibilities are endless. And I think going back to what Dr. Quezada was saying about oh my gosh, I just lost my train of thought. Oh, so about, when you're talking specific to medicine, when you're seeing patients, right? I think it's so important to have someone like us representative in that field, because it's about how do you culturally appropriately discuss with a patient, right? And not just the patient, but the patient's family. And so there's some insight there. And I think the other thing is that if we don't have Latinas in STEM, I think diversity of thought's super important, but I think what's more important is when you have this diversity of thought, they might be able to pinpoint problems that other people don't even see or think they exist, right? And so how do you find solutions for a problem that you didn't even know existed? And I think there's so much opportunity. So I would encourage women to just stick with it.
It's really great advice. I'll hand that over to Dr. Quezada Ruiz as well to share some of those thoughts, on this particular topic.
Sure, absolutely. I mean, Carol, that was phenomenal advice for sure. And I agree. I think that, in general, my advice to any young Latinos in general, who want to enter the STEM field would be, kind of along the same lines that, just go for it. It will be tough, in particular, I'll speak about medicine. You'll sacrifice time, you'll sacrifice your sleep, your immediate gratification. But, if helping others is really what you want to do, and by virtue of that, you want to become a physician, then just go for it. I mean, you can always change paths if you decide that's, that wasn't actually your path. And worst case scenario, you actually, just gain some experience and knowledge, and those, I think that, experience and knowledge are always useful regardless of what you end up doing in your life. In addition, for this, I would say, just get involved early, research about, what are the options, for getting funding, because I know that for us Latinos, that financial burden is really, it's really kind of a big dark cloud for many of us. I can sympathize with what Carol was mentioning at the beginning around, that imposter syndrome, and I think that especially nowadays, there are more and more organizations like LULAC, for example. In the Bay Area, I had the privilege to work with a nonprofit called the Bay Area Gardeners Scholarship Foundation, that actually serves underserved minorities, and provides scholarships for people to provide and go to higher education. So there are resources, but we certainly have to reach for them and look for them. I mean, I want to go back to this foundation, the Bay Area Gardener Scholarship Foundation. I mean, it has a beautiful background. It was founded by this phenomenal human being called Catalino Tapia, who was an immigrant who came from Mexico and worked as a gardener. And he was telling me this one day how, one of the best moments in his life was when he was driving down from San Francisco to LA with his son, who had just graduated from law school in Berkeley. And he remembers having this immense feeling of love and joy that he thought that every father should be able to experience that feeling in his life, in their lives. And that's why, he started this foundation, and they're helping a lot of students nowadays. And I'm sure that, that foundation and others, will be and be able to provide support to a lot of Latinos who want to pursue this novel path of medicine.
Absolutely. That is such a touching story. And I think that a lot of our viewers, I myself can relate to that, being first generation Mexican American. It is a family effort. And I completely agree that, we need to have those resources available for all students that want to go ahead and pursue, and this is why organizations like LULAC take the initiative to, one, make these programs, also be able to go ahead and promote these opportunities, and working with our partners like Genentech, like NovoNordisk, to go ahead and really, identify this talent, create that pipeline. Just thinking about the healthcare industry in the last year, thinking about the changes that have happened globally with COVID-19 and just some of the health inequities, we're seeing these gaps get wider. We're seeing the demand for more professionals in these fields grow. What is your vision, in terms of this industry changing? How can it reflect the needs of minorities and Latinas entering into the profession? Carolina, we'll go ahead and start with you on this.
Yeah, I think what I see changing is that they, like you were mentioning, I think companies are looking for diversity, right? So I think there is an increased focus on that. And I really do believe that it's important. I think that the healthcare and STEM jobs are the jobs of the future. And so you want to have individuals, like Doctor was saying, we make up a large demographic, right? And not very many of us are in these professions currently. So I think that there's definitely a push, and I think organizations like yours and even other organizations within the community is what's going to help kind of guide some of this. And one is not just the organizations as far as where you're employed, but academic, right? So how can we even make that first step to getting into college and succeeding academically in these universities and colleges?
Absolutely. And Dr. Quezada, Ruiz, can you share some thoughts on that as well?
Absolutely. I fully agree. And I think that the change is already happening, and I'm very optimistic, of being a witness to this change happening already. Minorities, including us, Latinos, are a growing population. In a few years, I think by 2045, the projections are that the US will become a majority country. And this will, I hope, increase the pool of people who may want to go into healthcare. However, it's not only about increasing, the chances of having more people, but I do believe that unless we take bold action today, that the disparities that we've mentioned, will become even larger and even more evident. So I think I fully agree with Carol that increasing access to high quality education from elementary all the way up, and providing financial and emotional support, because one thing that we haven't talked about, although we had alluded to, is the fact that emotional support is so important as well for minorities, including us Latinos, who are in general a very family-oriented culture. So I think this and other tactics may help support and change the current situation.
Yes, thank you so much. And it is so incredibly important. It feels like we're always going to be a student of life, even in our professional careers. And again, thank you so much for sharing your thoughts. As we start to close up this particular workshop, I want to go ahead and shift it to both of you to, have some parting words on just any last advice that you have to share with our audience members regarding the career, the development, mentoring, any parting words that you want to share with our audience members. We'll start off with you, Carolina.
Yeah, so first I want to say thank you for this opportunity. I was very excited when NovoNordisk kind of sent out a little thing in our ERG, and anybody interested, I'm like, me. I didn't realize the extent of what I was agreeing to, but this is great. I love opportunities like this where I can help others, because I feel like if I had something like this, who knows, the possibilities might have been endless, right? But the good thing is we're giving back. I think for me, the best piece of advice that I probably needed coming up, and I will share with your viewers, is don't be afraid to ask for help. I think I was raised to be very proud, and you figure it out yourself, and you can do this, and you just keep trucking through. And so sometimes I didn't ask for help when I needed help. And I think if I had, going back to the whole mentorship thing, I would have probably found a mentor much sooner. So don't be afraid to ask for help. Everybody's in a different journey, and that's okay. It's okay. It's okay. Just stick with it.
I think that's wonderful advice. Dr. Quezada, Ruiz, any parting words?
I mean, it's extremely difficult to follow Carolina's advice. I fully agree with all she said. I think the value of mentorship and advice, it's can never be undervalued. I mean, it's so important, so critical. And being not okay, it's okay. And I think we need to change our mindsets and just be comfortable with that. Without trying to be perfect, as we sometimes might seem that we're we're kind of forced to, and in that sense as well, I do want to highlight something very, kind of, close to my heart as well, and my own, profession, which is the fact that more societies are, becoming aware and recognizing this value of having, a physician that represents the population that they care for. And the American Academy of Ophthalmology in particular has been pioneering some of these programs to support minorities, and spearheaded by Dr. Keith Carter, past president of the American Academy of Ophthalmology. The AAO has started now a mentoring program that's called the Minority Ophthalmology Mentoring Program, and which I see a lot of value. I wish I would have had that opportunity in the past, and I'm so glad that people are seeing the value of this and moving this forward. And not only am I part of that work stream as a mentor, but also Genentech has been providing support, and we're trying to give access to different educational and research activities that we have through internships, PhDs, and so on and so forth as well. So I think that the future is bright. We just have to raise our hands and reach out to people, as Carol said.
I think that's wonderful advice. I can't thank both of you enough for everything that you are doing, not only in your line of work, but also making sure that this new generation of healthcare workers are, prepared to go ahead and be successful. And again, thank you so much for joining us today. Thank you to our audience members for joining and tuning in. I hope that you are enjoying the 2021 LULAC Virtual Summit, and we'll see you soon. Thank you so much.